So a lot of people ask me about the specific uses for stem cells and regenerative medicine, and neurological issues is a common question. People say, well, can it help with neurodegenerative diseases? Neurodegenerative, meaning wearing out of the nerves. So the classic ones are either localized nerve injury or systemic nerve issues like Parkinson's or MS. And I've had patients with both Parkinson's and MS where we've given intravenous stem cells, and the patients have noticed improvement in their quality of life and improvement in their symptoms. We also locally will go into where a nerve is irritated and inject in the lumbar spine or in a nerve root or near a nerve root the stem cells to create a healing stimulus. The idea with nerve injuries is that they take a while to heal, and if it's a direct nerve injury, they say 3 millimeters or a millimeter a month. They say it takes to heal and repair a nerve injury. So if we can stimulate a faster healing response, stem cells can be a powerful stimulus for nerve cell regrowth. So systemic neurological diseases like Parkinson's, MS, maybe even ALS, Lou Gehrig's disease, have the potential benefit of systemic delivery of stem cells to stimulate a healing response. Now, none of these have been clinically tested, but there's no downside. If we deliver stem cells into the body and the patient feels benefit, to me, that's avoiding a drug, it's avoiding a surgery, it's avoiding, sometimes, like an incurable disease like ALS, avoiding death if we can prevent some of that nerve loss. So I think stem cells systemically have a great potential use over the next decade or so. One of the biggest concerns people give me about stem cell therapy is like whose stem cells, and was this placental stem cell, and the whole thing with fetal stem cells, somebody else's. That's not used anymore. When we use stem cells, we're going to generate it from your own body. They're all over your body, from in your skin to the lining of your tooth, your dentin, to every part of the body, but they're stored in great concentration in the fat and in the bone marrow. So we take one of those areas and we either get the bone marrow or adipose, and then we process it to basically concentrate a delivery system of stem cells so that we can put it back into the body in a specific area. When we're talking neurological diseases, we typically want to give it back intravenously in the tissue, or sometimes we'll give it back in a nose spray, because the back of the nose is very close to the brain, and we'll combine those two delivery systems. So the concern of this is of stem cells is there going to be any adverse reaction? Well, these are the cells that are in your body that stimulate a healing response. So you can have a healing response or a healing crisis that could include even some aches or pains or fever. They're very transient, and it is the natural way of the human body, when it's stimulated to heal, that you may generate some response with achiness or fever. Generally over time, the first day or two, that's the main side effect. Otherwise, the procedures are pretty well tolerated to basically get the stem cells and isolate them. The procedure itself of either getting the adipose or getting bone marrow is in itself a 5 to 10 minute procedure. We wipe you down, we clean you up, we set the areas up, so maybe the whole thing is a half hour, but the actual procedure is pretty short. The recovery from the procedure, possibly a little black and blue mark, a little bit of bruising, usually not any more discomfort than a black and blue mark for a day or two after the procedure. The healing response is stimulated, but I tell people to give themselves 3 to 6 weeks to see the benefit of the healing. It's not like a drug that's going to suppress a symptom today. It's about stimulating faster healing through regenerative medicine, and this takes time. So depending on the age of the patient, 3 to 6 weeks.